Shawnta. Oh. Hey, welcome back. I'm Shawnta, health educator with the Southern Nevada Teen Pregnancy Prevention Program.
Hi, I'm Dr. Annette Mayes, OBGYN locally here in Las Vegas, and welcome back.
Okay, so what we just did a condom demonstration, and Dr. Mayes and I were just talking about how sometimes men or guys in general don't understand that it's the importance of leaving room at the tip of the condom.
Yeah, because I could see where they would think you would want it to be tight on there, and it's really important that it not be tight at the tip.
Right.
To allow that room.
Or even doubling up. So some people think it's okay to put 2 condoms on. No. Science experiment. Just remember that, science experiment. Then speaking of science experiment, we want to avoid those. So what I have in my hand is a personal lubricant. So this is water-based. It's okay to use water-based lubricant or silicone lubricant. And the purpose of lubricant could be to create a more natural feeling for sex, for a more pleasurable experience for both the male, and the reason I say male is because we're talking about the male condom, for the male and his partner. So basically with lubricant, if the guy wanted to, he can put a dab or 2 of lubricant inside of the condom or on the tip of his penis before he put the condom on. And then that helps the partner respond to, for example, if the guy says, you know what, I don't want to use a condom because it doesn't feel natural.
Right.
And putting the lubricant inside of the condom or on the tip of the penis before the condom is applied helps and gives a more natural feeling during sex. Okay. So that's something that we tell people too, because a lot of people say, oh, I don't want to use a condom because it doesn't feel natural. So my thing is, or at least with the Southern Nevada Health District with our Teen Pregnancy Prevention Program, is look, abstinence is the only 100% way to prevent pregnancy, to prevent a sexually transmitted infection, and to prevent HIV. However, if a person is not going to be abstinent, your best bet is to use a condom. And if you are going to use a condom, you need to use that condom consistently, and you need to use it correctly. So that was the purpose of me doing the demonstration for the condoms. Not because I'm encouraging young people to go out to have sex, but if you are choosing to have sex, I want you to be informed and for you to be able to make those proud and responsible decisions on how to take care of yourself.
Yeah, and I even tell my teens that we can talk about 2 things. We can talk about birth control, be it birth control pill or whatever other manner of birth control we're going to do, but also the condom is always an important thing.
Right.
Because as a woman, you want to protect yourself from any STDs. And any birth control that I offer you won't do that. That's what the condom is for. So it can be a twofold thing. The condom can give you some birth control, but for me, my big thing is to push that the condom is to prevent STDs for the young woman. Okay.
So besides birth control and getting information on safer sex, do you offer HIV testing at your office?
We do. Yes, we do.
Okay.
We offer all STD testing, actually. So.
And how does that work with the HIV testing?
HIV testing that we offer is through blood work. So there's we offer blood work for HIV, syphilis, herpes, and then we do cultures, which could be from the urine or from a vaginal swabbing for gonorrhea and chlamydia.
Oh, okay. Okay.
Dr. Mayes, where are you located?
Oh, my office is at 700 Shadow Lane. I'm right next door to Valley Hospital. Major cross streets would be Charleston and Shadow Lane.
And how long have you been practicing here in Las Vegas?
Too many years. 18 years.
18 years.
Yeah, 18.
Can you tell everyone about your background?
Well, let's see. I'm from California. That's where I grew up. I did my training in Texas. And I've been, like I said, been in Las Vegas for 18 years. So all of my practice experience has been here in Las Vegas. And I initially worked for a big health care management organization. But I've been in private practice for the last 11 years.
Excellent. Excellent. And why did you choose to be a physician?
Wow. Let me think. There's so many reasons. You know, I think, well, I can tell you why I chose to be an OBGYN. I love the fact that most of my patients are pretty healthy. So I love talking and interacting with my patients. I like dealing with women. I like delivering babies. I like operating because I do a lot of operating as well. But I didn't want to be a surgeon because, you know, I take out your appendix and then I never see you again. But I like having the rapport with my women. So even if my patients have to have surgery, they still see me on a regular basis, and I enjoy that.
If you could have a conversation with the young girls in high schools today, what would be the biggest message you would want to bring home to them with regard to their health, with regard to how they deal with young men for the first time?
Yeah, you know, and I have a 16-year-old daughter, so the biggest thing that I want to get across to her and other teenagers is to put themselves first and to make sure that whatever they do, whatever they choose to do, because of course I would rather that my daughter not have sex. That would be what I would want her to do. But if you are going to have sex, that you protect yourself and that you cannot rely on the guy to offer protection. You cannot rely on what he says. You can't rely on him to say, oh, I'm clean, I don't have any STDs. You need to protect yourself, because that's the bottom line. We all got to take care of ourselves, and I just want young women especially to know that. Protect yourself.
And what do you have to say about multiple partners? A lot of young men think that it's cool to have multiple partners, and there are some girls who, you know, want to show the young guys that, hey, they can do it too. Yeah. What message do you have for those promiscuous teenagers that may think that because they're so young and that they're not vulnerable?
Yeah, and I guess I see the consequences of being promiscuous. I see the consequences of women and young ladies who choose to have multiple partners, and those consequences are STDs, those consequences are pregnancy, those consequences are cervical cancer. Because one of the biggest things that we know that can cause cervical cancer is multiple partners. So because it's, you know, you're exposing yourself to a virus that can cause cervical cancer. And the thing to remember, even if you have one partner, if you're not using protection, if you're not using a condom, if he's had multiple partners, that means you have had multiple partners, because you're exposing yourself to everybody that he has slept with.
Exactly.
So the bottom line is just, you know, take care of yourself. Remember your health. Take care of yourself.
Thank you.
Thank you.